So at the Goldman session, when I'll be chairing, we have, I think, some really good information coming. First, regarding children, which I think still remains an understudied or less, we've been less able to study the area in CML. I think there's progress with newer drugs being moved into pediatrics, but we still have some real important questions about long-term results, optimizing therapy, decision-making, because transplantation is much more relevant often in pediatrics, or at least a relevant discussion. And then I think the last frontier will be treatment-free remission. Those are the most valuable lives you want to revert to normal as kids. And so I think there's a lot of efforts. I'm glad to be collaborating with some important pediatric CML physicians as of late, and I look forward to more progress in that area. So in addition, the session will also hear about potentially what will allow us to help differentiate, besides the risk score and our own decision-making and comorbidity assessment for patient, how to decide between a first and second generation TKI. I think there's some nice biomarker data, and I think we've seen in other research projects the fact that myeloid mutations might play a role as well, and patients might be better off with second generation TKIs, even with perhaps low risk SOCAL or European long-term survival score. So I think that's also important. And then lastly, the pandemic's not over, and we still need to know more information about how our CML patients did. We've done a lot of work as a community through the ICMLF looking at the challenge of SARS-CoV-19 and the impact in CML patients, and thank goodness it's been rather neutral. But vaccination response, long-term outcomes are important questions, and we're going to see a bit of data on vaccination response as well.